Hello there, welcome to Health Options. Meningitis is a devastating disease with a high case fatality rate and leads to serious long-term complications. During the dry season, that is November and May, high temperatures and low humidity increase the likelihood of transmission of organisms causing cerebrospinal meningitis. The rapid progression of meningitis frequently results in death within 1 to 2 days after onset. Many organisms can cause meningitis, but bacterial meningitis is of particular concern as around 1 in 10 people who suffer it die, just as 1 in 5 have severe complications. Of the 36 states in Nigeria, 25 states and the FCT are in the African meningitis belt. How prepared is Nigeria to mitigate the impact of meningitis as another season of the deadly disease beckons? Get to know the symptoms of meningitis and prevention as we focus our attention on cerebrospinal meningitis on this week's episode of Health Options. Thank you for joining us on the program. I am Rabi Abdullah. Welcome back. If you're just joining us, this is Health Options, and we're taking a look at meningitis season and Nigeria's preparedness. To take us through the discussion is Dr. Priscilla Ibekwe. She is the Director of Special Duties and lead of the National Cerebrospinal Meningitis Technical Working Group at the Nigeria Center for Disease Control, NCDC. Welcome to Health Options, Doc.
Thank you.
All right. I dread meningitis. I dread the season, the dry season. We're already in the month of November, and that means we are likely, most likely, to experience meningitis outbreak. And this is not far-fetched from the fact that Nigeria is one of the countries that lies within the meningitis belt. Should we be scared or have any, cause for concern as it is now? Are we already having outbreaks or are there potentials?
We don't already have outbreaks of meningitis at the moment. Okay. However, we are in the meningitis season, like you rightly said, which is the annual season. During the hot weather, the number of people that have meningitis, the number of cases increase. Meningitis occurs round the year. So we should always be aware of the signs and symptoms of meningitis. However, the number of cases increase during this season. And that's the reason why in this season, we want people to know about the signs and symptoms of meningitis. We want the healthcare workers to be more aware, heightened awareness so that when patients come with the symptoms, that they pick them up.
Okay, heightened awareness.
Yes.
So let's go back to the basics now. Let's understand what meningitis is all about.
Okay, so meningitis is infection or inflammation of that covering of the brain and the spinal cord. And so it is caused by several organisms. It can be caused by bacteria, it can be caused by viruses, by fungus, but the ones we are particularly concerned about is bacterial meningitis. And there's one called the Neisseria meningitidis. They have several serious subtypes of it. Type A, B, C, X, Y, and W. We are very concerned. But these types shouldn't be a problem in terms of the public. They don't need to know the details of that. That's the different types that scientists will find in the lab. But they cause the same type of symptoms. And we want people to be aware of these signs and symptoms, which include high fever, headache. Somebody may even go into having a seizure, convulsing, altered consciousness. That person is really drowsy, sluggish, can't wake up, not really concentrating well. Some people also have neck stiffness. They can't really turn their neck. And another frightening symptom is difficulty tolerating light. The light, like in the room, you are finding it difficult to cope with that light or even going to the sun. very strong headache. So it's very important that people, as soon as they recognize these symptoms, that they quickly go to the nearest health center. And for children, a very big, other problems they could also experience: difficulty eating. That child sleeping too much, the child may even convulse. For some babies who are less than 1 year old, there's something called the bulging frontanel. So here, for every child less than 1 year, the mom, when they are bathing, they can feel that little dip here. But it is bulging, it's more like a ball. Okay. So it means that there's something really wrong. And with these symptoms, that child should be taken to the hospital. And not only a child, meningitis can also affect adults.
Yeah, I was going to ask.
All ages. However, it tends to happen more among young people. I mean, younger people less than 15.
Knowing the risk factor for disease, goes a long way to checkmating it,
exactly,
or checkmating the impact. I'm just wondering, is it likely to occur? Does it have anything to do with poverty, location, environment? Or let's get to know.
Okay, so I'll start by saying meningitis first is an airborne disease. So when people cough, sneeze, the risk of passing meningitis is high. And also the meningitis organisms, for some people, it's in their noses. So it's again around breathing, okay? So it's airborne. Now, what are the risks? Where people are in overcrowded environments, overcrowding is a problem. So we want people to stay in an environment that is, or houses where that is well ventilated. People can open their doors and windows. I know that we can have security problems. So you want, as people build houses from now on, being aware that we are always in the meningitis belt. Houses should be built with the mind that there should be better ventilation. You also want to avoid overcrowding in dormitories, like in secondary schools. So you sometimes hear that there's an outbreak of meningitis in a particular school. So you want to reduce the number of people in a class. You want to reduce the number of people in dormitories. You also, like the NYSC camps, where people, or the army training centers, forces, wherever people are gathered and sleeping, we need ventilation. Okay. So it's very important. Now you also asked me about the environment. All right. We also need an environment that's, your environment has to be healthy. Your environment has to be clean. So the air around you needs to be clean.
Clean air.
You clean air. And also just to keep, again, you asked about poverty. It's not so much about poverty. It's the fact that you need to eat well, have a balanced diet. All this helps to build your immune system. Okay. So you want to eat, protein. You want to eat, you have vegetables in your diet. Yeah. So you want to have some vitamins, anything that would help nourish your body to help fight infection. You also want to drink a lot of water. Water is good for you. Okay, so it's just all part of making your body healthier. Not only that, you need to sleep well. Sleep is refreshing. Sleep helps to build your body. So these little things that you do are very important.
Okay, so let's get down to the real topic now. Nigeria's preparedness. Since we're already aware of the risk factors, we know it's a seasonal disease. You've enumerated, forms of, sensitization, awareness, and all of that. You mentioned schools and other places that people are likely to be crowded and all of that. Have you embarked on those sensitization?
So,
well, then let's just know, what is it that you're already doing? Since we know the time is coming, is here. What have you done before now?
So that's why we have the National Cerebral-Spinal Meningitis Technical Working Group. This is a group of experts that sit together to develop plans. So we already have, led by NCDC, we have the national guidelines for cerebrospinal meningitis, which clearly states what each person should do, what the healthcare workers can do, what can be done at the state level. So, for example, in NCDC, we are pulling together every year. We update our national preparedness and response plans. Not only are we doing that, we are also supporting the state to do their own state preparedness plans, ensuring that you have a committee of, a committee at the state level, health planners at the state level that also replicate this type of plans we have at the national level. We also acquire, try and buy, procure meningitis commodities, medicines. We also procure lumbar puncture kits and reagents, so that we ensure that we procure these things and distribute them to the states. We also encourage states to buy their own. Of course, NCDC cannot buy for the whole country, but I mean, that is have enough for the whole country. But at least we have some that we can use to respond in case an outbreak occurs in the state and is beyond them. And that is why we are using this opportunity to also plead with the, health planners at the state level, commissioners of health. We've already written out letters to all commissioners of health to support the public health departments and the state epidemiologists and the teams working in the state. So the same way, states are also supposed to buy health commodities, pre-position them, make sure they are stayed in all treatment centers. Every local government should have at least one treatment center. That is a general hospital where there's a doctor and the commodities are right there already at the state level, already in the hospital setting, so that when patients are referred, even from the primary healthcare center, do have the appropriate reagents to test, and there are drugs to also administer to these people, because it is treatable.
How much of synergy do you have between you and the National Primary Healthcare in that regard? Because I'm aware of the conjugate vaccine that has been introduced into the nation's immunization schedule.
Exactly. So you recall that there was a big outbreak in 2016, 2017 with over 14,500 people. That was quite devastating. And there was a massive vaccination campaign with Menafrivic, that's the type A vaccine. And we have worked very closely with the National Primary Healthcare Development Agency, and now that vaccine, type A, is now routinely introduced in all states of the Federation. What does that mean? We have found that in the past few years, since 2016, 2017, we've not had a single case of type A meningitis, okay? Which means we're encouraging all parents, uncles, brothers, and sisters to encourage their neighbor to ensure that they take their child for vaccination, so that they are not at risk of at least that type A meningitis that we already have. And this is so important. Every death from meningitis that is preventable is a death too many, and we must stop deaths from meningitis, especially where they are preventable. And the second concern is the fact that 10 to 20% of people who have meningitis suffer from long-term complications.
Exactly.
So when you think about...
For those who survived it, what are some of,
So I'll come to the complication, but it is alarming because if you think about what happened in 2016, 2017, with 14,500 people suspected with meningitis, if only 10% of them had long-term effects, we're talking about 14,500 people times 2. That's nearly 30,000 people with long-term conditions. What could they have? Some of them had impairment, cannot see because of that meningitis infection. Some have completely lost their sight. Some cannot hear well. Some have gone completely deaf. Because of the overwhelming infection, sometimes people get to lose their limbs, their legs or their hand, and it's cut off. So not only that, some people have complications where they are finding it difficult to study. They can't learn well. You see an intelligent child, and now he doesn't understand. It takes him more time to understand things, days. So learning disability for the rest of their life. So these are the things, and that's why we really have to be very concerned that we must prevent any meningitis case, and if we do find any cases, that they quickly go to hospital to reduce the risk of complications, and to think of the fact that anybody with meningitis, survivors, it's good to survive. We're grateful that they are alive. But when they have these after effects that are some of them are for a lifetime. Now think about a parent or parents and a family that is taking care of somebody with meningitis complication. For that period, that child is growing up and all that. It actually stops the parents from doing their normal work. They spend a lot of their energy, their resources. They are not able to work as they used to. That is why meningitis is everybody's business. There should be a comprehensive package of care and support, even from the community level, and not leave parents alone. And don't forget, it's not only the parent, the child, or that has, had this, that has this problem, that is also suffering. The mother is suffering, the father is suffering. So even the parents need psychological support.
I just want to find out this, because, from the things you've enumerated so far, stemming the tide is supposed to be multisectoral, because if you talked about, crowded environment, the houses we live in and all of that, what are, we know where the what do you call it now, the danger zones are.
Yes.
It's very easy. When you see an environment that is a hotbed or a potential, environment for meningitis outbreak, you will know. It's just like cholera and all of that. We know where you don't have toilet facilities, when you don't have clean sources of drinking water, that is a hotbed for cholera. Okay. I don't know, what sort of synergy is going on in this regard?
Okay, so what we need to do, starting from the health sector, which is my own domain, right, is that we would need to develop guidelines that helps doctors and the whole health system not only to treat that patient. So when they treat the patient, they also need to tell the patient the kind of symptoms, because some of these symptoms or complications don't occur immediately within the hospital, because that patient may be discharged and then 6 weeks later or months later, the parent will now find out, oh, this child is not hearing well. So even from the point of discharge, the doctors need to tell the patient the kind of symptoms or signs that may happen, so that when they recognize that, they come back to hospital for help. Now, that help will not be necessarily by the doctor who treated that patient. It will now be going to the specialist for ENT, for nose, hearing, or for sight to provide that support. So we need comprehensive package of referral guideline and care are developed around somebody who has survived from meningitis.
Okay. That was the plan.
Yes.
Launched in September.
Exactly.
And that's the target is 2030.
2030.
Okay. So is Nigeria doing anything differently in keying into that global target? It's
not only that Nigeria is doing differently in keying into the global target. We have been at the very forefront of this conversation, right from 2016, 2017, 2018, when Afro-Africa, Afro WHO, World Health Organization, the African branch,
regional committee.
The regional, yes, recognized this as a problem. They pushed and ensured that meningitis becomes prominent in the program of work for WHO worldwide. And Nigeria also supported that process in all the technical work that was done, meetings. Nigeria was there. What does that mean? We now have a global strategy, the first ever strategy on focusing on meningitis. And even Nigeria supported, was at the, in Geneva also, strategy is there are three key things. We want to reduce epidemics occurring from meningitis. We want a world free of meningitis. We want to reduce by 70% any epidemics from bacterial meningitis, and we also want to reduce deaths occurring from bacterial meningitis, and also ensure that we have package of care for people that survive after meningitis. So the technical working group is already developing the guidelines that would help ensure that this happens. Now we are also calling for that same work to be done at the state level. Not just developing the guidelines, but providing the resources and funds that would help implement. And this is not only for the government alone. We are calling on philanthropists, we are calling on community agencies, we are calling for the NGOs as well to raise our voices and to raise awareness of these plans and also advocate for funding in this area.
Okay, so from the mode of transmission now, it's airborne and all of that. It means being in a pandemic, talking about coronavirus now, if all and sundry, keep to the guidelines, the safety guidelines of nose mask wearing, hand wash and all of that. It means, so will it be right to say maybe, practicing or imbibing all this, safety culture must have helped one way or the other?
Yes.
In reducing incidences of meningitis, within the period that we've been in the coronavirus pandemic?
Yes. So there has been a drop in the number of cases of meningitis which we experienced in 2020. Okay. There was just a recent conference of on meningitis by Meningitis Research Foundation in UK. It just happened on the 1st and 2nd of November, and there were lots of papers, clear evidence from data across many countries that there had been a reduction, not because people did not go to the hospital, or it's the fact that with the social distancing, with the wearing of masks and better respiratory hygiene, there's clear evidence. So this is something that has also really shown us that this is really airborne, and if we practice the respiratory hygiene, we avoid overcrowded areas, we can actually reduce it. That is one. Secondly, like you said, we must continue to use the vaccines that are available. And with the defeating meningitis strategy, there's a lot of work being done right now to get the best vaccines available, more vaccines that, the kind of vaccine that will cover other subtypes of meningitis, like I said, the C, W, X, Y, to put them all together as one vaccine. So a lot of work is being done, and it needs the pre-qualification by WHO. If they meet that target in that big and large quantity, then we'll have better vaccines to also put out and also use them routinely.
Okay, thank you so much. I want to believe that the commodities necessary for, just in the event of outbreak are all ready from, are you giving Nigerians?
Yes, so right now as we speak, there is a technical, the supply chain management of NCDC is holding a meeting in Nasarawa right now, doing a quantification of all things that are required, commodities that are required for health, infectious diseases across the country. So they do this at least once a year. That is not to say that we don't have some already, but we want to get the right numbers. Okay, so we have already procured some. The technical team on supply chain management are trying to find what is the right quantity we need in case that there is an outbreak, so that we can procure more and be ready.
Okay, I don't look forward to any meningitis outbreak.
I hope not too.
I just hope Nigerians don't face, see themselves faced with that again. Thank you so much, Dr. Priscilla Ibekwe, for sharing your thoughts with us. Thank you.
Thank you so much for having us. Thank you.
That does it on this week's episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. Stay safe and healthy. I remain yours, Rabi Abdullah. Hope to see you again.